That's a good catch. Go. That was a good catch.
And hello and welcome to Inside Lincoln Hospital. It's the heart of the Bronx. Today, we're going to be talking with Dr. Akinola Fisher, Chief Ambulatory Care and Deputy Chief Medical Officer at NYC Health and Hospitals at Lincoln. We'll discuss what drew him to a career in healthcare and all the latest updates at Lincoln Hospital. Our conversation with Dr. Fisher will also focus on the services provided by the Pride Center at Lincoln, including the range of care options available and for all the patients and beyond. So I'm the Dr. Bob Lee, and this program is brought to you by Bronxnet's media, brand new media and technology studios at NYC Health and Hospitals, Lincoln. Dr. Fisher, thank you for joining us today.
Yeah, thank you for having me.
Can you tell us a little bit about yourself, a little background, and what initially drew you to a career in healthcare?
I'll give you the Cliff Notes version.
Yeah.
So I'm Dr. Akinola Fisher. My pronouns are he and him. And I actually got interested in healthcare. It was part of my after-school program when I was growing up. My mother was a pharmacist and obviously worked in a hospital. So I loved the collaboration that you had with the staff within the hospitals. So I actually never thought of any other career than working in healthcare. And luckily I was able to get into medical school, which I did in Nigeria. And from Nigeria I trained in England first for about 7 years, and then moved over to the States and did my internal medicine residency at Inglewood Hospital. And been working in the Bronx for quite a while. I started working in an FQHC, Morris Heights, and now moved over to Lincoln Hospital in 2010, and I've been there,
So you grew into this coming from school. The after-school program was the drugstore. So you learned all about the drugs and the interactions of the drugs?
The interactions, and just the collegiality between doctors, nurses, pharmacists.
And patients.
Yes, and patients.
Yeah, patients that come to the drugstore.
Yeah, and also how important it was, the way you relate with, patients and their families, and how you can support them, not only for their medical care, but looking at other things that they need. So it really was.
And in your position, you oversee many of the clinics at Lincoln Hospital, including the Pride Center. Can you explain what that role entails and the responsibilities that you manage in your position?
Yes. So, we have 63 different practices in the hospital. And the way I see my role is that I support all the clinical teams to ensure that they're providing compassionate care to our patients, making sure they're doing it with integrity and accountability, and making sure that everything we do with excellence. And obviously, I'm responsible also for access, making sure that our community has access to medical care, both primary care and subspecialty care. And so the things we look at is how easy is it for people to get appointments to see their doctors, and how easy it is for us, for the specialty practices, to get referrals in from our community doctors as well, so that our patients' medical needs are met. And because we have populations in care assigned to us, so patients we look also, are we doing everything we can to improve the health outcomes of patients with chronic illnesses such as diabetes, hypertension. And we also run programs that provide support for patients. So for instance, we have the Cancer Services Program, which helps our community to make sure that they have access to cancer screening services. We all work together. I see myself more as a conductor of the orchestra to make sure that we create excellent medical care for our community, and of course ensure that Lincoln Hospital is a fantastic environment for our staff as well.
So Doctor, it sounds like the Pride Center offers a variety of services. Can you tell us a little bit about the type of resources offered at Lincoln?
So the Pride Center is one of the interventions we had at Lincoln to make sure that we are cognizant of the needs of our community. And so the Pride Center was created to address our LGBTQ community, to make sure that we provided an area where they were comfortable providing care, cognizant of their lived experience. In all our 63 practices, we are able to see LGBTQ patients, but this is just being cognizant of their lived experience to make sure that people were comfortable engaging in healthcare. Just as a plug, the hospital as a whole was recognized for LGBTQ health equality by the Human Rights Commission. So in whatever practice you choose, it's just giving people a bit more options, just cognizant of their lived experience that we want them to engage in care where they're comfortable.
Yeah. How do you ensure patients are treated with respect and dignity?
Yeah. So one is wherever you receive care in Lincoln, you're going to be treated with respect and dignity. But the additional thing we do in the Pride Center, all our staff are trained to ensure that they learn how to interact appropriately with particular sensitivity to our LGBTQ community because of their lived experience, so that we're not creating anything that can, make them not engage in healthcare. And so there's an extra effort to train the staff to make sure that, we really make that visit comfortable for our patients.
Beautiful.
And part of the services we provide, as I said, is an integrated care service. We have primary care. So not only do we do, treating your regular chronic diseases, hypertension, making sure you get your screenings, we also do gender-affirming care where in your care transition journey, if you need hormonal therapies, we offer that. We also have access to providers who do procedures, top surgeries, bottom surgeries, some in-house at Lincoln Hospital. And for those that we don't do in-house, we refer you to other specialty centers that can help.
And everybody knows what top surgeries and bottom surgeries are.
Yes, so just to clarify, so top surgeries for people, for instance, who want augmentation of breast tissue to make them live in the gender they identify as, or sculpting to make sure that you have a more male-looking appearance, and obviously bottom surgeries are people who want to have hysterectomies or oophorectomies.
Yeah. And what are some of the misconceptions, common misconceptions people have of the Pride Center? What are some of those?
So I think the greatest one is that we're only doing gender-affirming therapy, that it's only for people who need hormonal therapy. It's actually comprehensive medical care. So we look after your primary care needs, your cancer screening services. We have programs that treat your chronic illnesses to make sure you get to control. So for instance, our Pride service also has a treat to target program where if you're diabetic and not in control, or hypertensive and not in control, you work with a disease manager, which is usually a nurse, to help coordinate your care between the doctor and yourself to make sure all the changes are made to get to control.
You got it covered. And can you explain the difference between providing primary care services as opposed to gender-affirming care?
Yeah. So the way I would define it is primary care is really looking at all your health care, dealing with you having annual visits, you're preventing health services, dealing with chronic illnesses, hypertension, diabetes, and things like that. Gender-affirming care, at least in our Pride Center, in addition to doing those primary care services, we also we pay particular attention to where you are in your transition journey and support you in that process, both not only with medications, but with the psychological support you may need. And also we have ability to refer you to psychiatric services if required. One of the things in Lincoln Hospital that we also do very well is link people who may be struggling with substance use disorders to treatment programs. We have our recovery center where we can refer patients to, and some of our providers actually provide medical treatments for substance use disorders to help mitigate it.
Yeah, I was going to ask you about the referral program. Can you walk us through those steps for referring a patient in need of gender-affirming procedures?
So obviously we work with people with where they are. Contrary to what people believe, not everybody wants any procedures done. But for people who want procedures done, as I said, within our hospital, we have plastic surgeons, we have gynecologists. Obviously, we have oral surgeons who help with facial surgeries that people may prefer to do to help them in their transition journey. And then for people who have all the procedures they are considering that we don't offer, we work with them to identify providers in their community who are LGBTQ friendly, who we can refer them to help them perform those procedures.
Very informative, Doctor. Thank you so much. Dr. Fisher on the case here. It's time to take a quick break right here, but when we return, we will continue our conversation with Dr. Akinola Fisher, Chief of Ambulatory Care and the Deputy Chief Medical Officer at Lincoln Hospital. Stay tuned. We'll be right back.
We are the Echo Leaders.
We learned that everything starts with ourselves. Then we have to educate ourselves. Then we have to build community and use our imagination.
Echo leaders, you step from the future to save the past. Heal the planet and make it last. We find solutions with knowledge light. Venture forth, Echo leaders,
There's a new channel to explore, and it's bringing the classics back to life. During the day, relive the Bronxnet originals that sparked conversations and built community. At night, dive into the hip-hop throwbacks that defined a generation. One destination, two powerful lineups. Now playing on Optimum Channel 952, Fios 2138, and streaming at bronxnet.tv. BX Legacy, where history meets the moment.
Only 57% of New York City high school students are college ready by their senior year. "55% of high school graduates either have no plans to attend college or are uncertain that they will ever attend. "34% of young adults don't go to college because they can't afford it. Discover what's possible. Bronxnet's education programs, internships, and opportunities help engage and inspire Bronx youth and beyond to pursue their passions. Be a part of the Bronxnet family. Whether you're interested in our shows, joining a class, or donating to support our mission, visit bronxnet.org to learn more.
And welcome back. You're watching Inside Lincoln Hospital, the heart and soul of the Bronx, with Dr. Akinola Fisher, Chief of Ambulatory Care and Deputy Chief Medical Officer at Lincoln Hospital. Doctor, I tell you, you're a wealth of information, and I'm glad that you stepped into the room here. Let's switch gears a little bit and talk about the issues of concern for young adults. Yeah. Homelessness is a serious concern for this age group. How can they ensure recovery from major surgeries if stable housing is not an option?
Yeah. So, I mean, one of the things we do at Lincoln Hospital and what we do in the Pride Center is one, screen the patients for social determinants of health, with obviously housing being one of the social determinants of health, as well as transportation, employment, food insecurity. And specifically, we work through our social workers with community resources, one, to help house those that are struggling with homelessness.
Yeah.
And we also, if you were to have a procedure that you needed some period of recovery, we work with community providers of medical respite, where for a limited amount of days you can have a bed to recover from your surgeries, and obviously those facilities usually have some kind of nursing support. And so obviously we work, our goal is to always bridge any difficulties patients have with accessing care and providing support, and working with all our community members to try and mitigate those issues.
Yeah. And then, is that prevalent in our community, a lot of homelessness and people wanting to come into the hospital?
Yeah. So I think there's a lot of issues with unstable housing, and obviously sometimes that leads to homelessness. So what we do is, support. We have actually various programs that help continue to provide health care to people who are struggling with homelessness. For instance, we have a safety net program that addresses the healthcare needs of people struggling with homelessness. And our corporation does have a Home for Health program, where patients who are suffering with significant chronic illnesses are linked to housing services. And so we leverage all that support to try and mitigate issues with housing instability for our patients.
That's great to know. That's that's a concerning issue for a lot of people going in and wanting care at a certain area. Many young adults want to know which doctors are actually safe and respectful. How can they find safe, respectful doctors in the clinics?
Yeah. So I think one of the things which is why we created the Pride Center is that looking for a Pride Center near you. We have a contact center for the whole system, where you can call 888-NYC for NYC, and that gets you our contact center. I'd say asking for a Pride Center because that is specifically designated to meet the needs of LGBTQ members of the community. But we also have adolescent programs for younger adults that are run by adolescent specialists who are specifically trained to help the young adults meet their healthcare needs and understand what they struggle with, so that we can really tailor programs to meet their needs.
Yeah, and there are a lot of people who are afraid to come out. Fear of deportation is a real barrier. How can young adults access health care in New York City despite immigration status and lack of insurance?
Yeah. So Health and Hospitals Lincoln is part of the health and hospital system, and we do have NYC Care, which guarantees you access to a primary care provider. And we see, irrespective, as long as you live in New York City, irrespective of your immigration status, you can call the NYC Care line to enroll, and that they'll assign you a primary care provider. And from there on, we'll work with you to meet your healthcare needs.
Yeah, I mean, that's great, because that's great to know. A lot of people, you can see them. I mean, even in schools, people are afraid to go to school. Parents are afraid to come out. And a lot of people who are helping at Home Depot, they can help you with certain things, and they're experts at it too. They're afraid to come out and help out.
So as I said, we screen for social determinants of health, and so obviously we do have relationships to refer people to legal aid who may need it. But obviously, through the NYC Care program, we're able to meet most of your healthcare needs, and we have financial counselors within the hospital that also help to see, because some people still qualify for some kind of coverage, and so we work with people to make sure that where possible, we link them to care, and
Yeah.
where not, we just use sliding scale fees under the NYC Care program.
Well, let's elaborate on that a little bit. With financial concerns high, how can older adults access affordable gender-affirming care on fixed incomes or with Medicaid, especially LGBTQ elder communities with economic hardships?
Yeah. So one of the great things when you come to a Pride Center is that, one, we've usually created relationships to ease getting gender-affirming hormones for those that need it. But as a screening tool for any of the practices that you come to, for those that are uninsured or underinsured, we work with our financial counselors to link them to additional insurance, because sometimes people have Medicare, but they may qualify for a Medicaid additional thing, which working through the financial counselors, they'll kind of advise on the best options. And of course, because our goal is to make sure that irrespective of how you get to us, that we meet your healthcare needs, we also work with our pharmacy to ensure that you can get access to some of the medications you need.
Doctor, what comes to mind when I mention gender health and chronic diseases?
Yes. So I think some of the concerns people have, especially with hormone therapies, is that, will it make my diabetes more difficult to control? The reality is the most important thing to do is to follow up, because even for people who are not on hormonal therapies, sometimes with a change in your lifestyle, eating differently, you still need adjustments of your treatments. Yeah. And so there is no chronic illness that can not be controlled by adjusting the medications you're taking for it. And so I don't think that really prevents you from going on hormonal therapies if that is one thing you desire.
Yeah, especially individuals with diabetes. It's tough to manage this. It's a serious challenge while maintaining the hormone treatments.
Yeah. So the only thing about hormones, so for instance, when you're on estrogen, it can increase slightly the insulin resistance. So for people on insulin, we may need to adjust the dose, or we need to adjust the dose of your medications. So I think the most important thing is following up. That would be for irrespective of whether you're in gender-affirming hormones or not, to just make sure that your disease is controlled. And that's why we build the Treat to Target programs around the practice to ensure that everyone with a chronic illness has some additional follow-up, so that none of their chronic illnesses, if they were controlled, get out of control, and if they were not controlled, we're supporting them to get it to control by making those adjustments.
Quitting smoking is so very, very important, but why is it important for hormone users before surgery?
Yes. So smoking cessation generally is important for everybody before surgery. Because what the few issues with smoking. So one, in the short term, if you smoke, it leads to greater unnecessary complications with your breathing. So that's one. Because smoking also reduces blood flow at the capillary level, it really affects wound healing. And so the earlier you can stop smoking before your surgery, the better. Also, smoking increases post-operative complications like wound infections, seromas. It increases slightly the risk of deep venous thrombosis, which there's always a risk after surgery. And so
thrombosis will create
that's
blood clots.
Yes, that's blood clots. Yes, that's blood clots and things like that.
Heart attack.
Yeah. So we really encourage you to quit smoking. The earlier, the better. The optimal time is 8 weeks before your surgery. 4 weeks, obviously, is acceptable as well. But as soon as you can before your surgery is important. And they're very excellent treatments now for smoking cessation, which obviously we offer in the Pride Center as well, to link you to our smoking cessation programs at Lincoln.
Someone with HIV, does that stop the person from medically transitioning?
No, it doesn't. So in fact, in our Pride Center at Lincoln, we actually have 2 HIV specialists who provide the primary care there. And so they are very cognizant with interactions between the hormones and the HIV therapies. And they're able to make any adjustments and select the right combination of drugs to make sure that people stay virally controlled and pretty much live their best lives.
Yeah, and so they can do that with HIV suppression.
Yes, yes. So the goal in our Pride Center, especially where we have HIV specialists, is that we work with the patients to select the appropriate drugs and make the appropriate adjustments in the doses of the hormones so that they can get the effects of the hormone therapy.
Yeah.
So it's not a problem to transition in.
Wow, we learned a lot about what you're talking about right here. Thank you, Doctor. Is there anything that we missed or something that you would like to mention before we close up?
Yeah. So again, I just encourage members of the community to choose Lincoln as their source of care. We continue to strive to provide access to everyone in the community, and we have a lot of practices that can meet the needs. And one additional thing we do for our patients who get primary care at Lincoln, we also have an open access program now where they can come in to see a primary care provider when they're acutely ill. And so that's, those are the advantages that you get when you choose Lincoln Hospital as a place to get your care.
I'm going to ask the question. First of all, thank you, Dr. Fisher. We've learned a whole lot about the topic, but why should patients choose to go to Lincoln Hospital?
If you want to get compassionate, excellent care in your community, the place to be is Lincoln Hospital.
There you go. Yeah. Doctor, thank you so much for joining us. And be sure to come back again. Okay?
All right. Thank you so much.
All right. I want to thank everybody for watching. And remember, you can always watch and continue to watch. Just keep it right here, and we'll let you know more. The Dr. Bob Lee. Always remember this: what you are is God's gift to you. What you make of yourself is your gift to God. So choose your choice. Let your choice control the chooser. I'll catch you another day, another way, and I'll see you over 107.5 WBLS. I love you all. Peace.
Go, go, that's a good catch. Go, 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 that was a good catch. Go, 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 that's a good catch.